So Dr. Stott here again. Just going to do a quick video today about some positioning, which is really important. A lot of times when I'm working with new doctors, obviously we're working in dental school, we usually work alone. Very rarely we work with an assistant. When we do work with an assistant, usually it's one of our fellow classmates and they aren't really trained in four-handed dentistry. So today we're going to do some positioning around four-handed dentistry. I'm going to show you the way that I have found to be the easiest way to do procedures, and then I'll kind of go through some things that I see some doctors do that are wrong. And the main purpose here is to make sure that the doctor and the assistant work together very efficiently. And the big thing that I see is that doctors get in the way of the assistant, and then the assistant either sits back and feels like she's not really participating in what's going on, or she gets frustrated because the doctor is in her way. So we'll go ahead and take a look here at some of the positionings on every single tooth and every single quadrant so that you can get an idea on how to better position yourself, especially if you're currently in dental school or if you're coming out and being a new doctor. So one of the first things that I always tell new doctors is when we're working on the maxilla, I always like to go back super far. So what I see first of all is that doctors put the patient up too high, okay, because they want it up kind of like this. The problem with this positioning is if I'm trying to look at the back side of a tooth and it's way up here, I can't go through this portion of the tooth to see it. The easiest thing is if you drop it down. If you see this, if I drop this down, I can start to see the back side of that, okay? So the concept is with maxillary teeth, I am going to drop the patient back, okay? And you can see how far I'm going to drop them back. I'm literally going to drop them back as far as the chair goes and then get the chair back, okay? Now, when I look at the maxillary teeth, do you see how I'm positioned here? How my back is straight, and it's very easy to see all of the teeth. When I am up here, I have to do a lot of bending over to see a lot of these posterior teeth, and that becomes super difficult if I'm doing a root canal on the second molar. It becomes very difficult to do positioning like that versus like this, and with this I can do a lot more direct vision. Another concept that I like to teach new doctors is the idea of calibrating and then going in blind, okay? Now, a lot of times new doctors are going to want to use their mirror almost exclusively for everything, okay? The problem with that is as my mirror is over here, I'm now blocking the assistant away from being able to do her part, okay? So what I do is I am going to, let's say I'm doing a DO on number 5 here, I'm going to calibrate on the way that I want my burr to face. I will start drilling, and then I'm going to come over here after the assistant is out, and I'm going to take a look. So I'm going to be doing a lot of this, 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 this. The nice part is that my mirror is never getting full of water, and if I have to dry off my mirror, I'm going to do it right here with the patient bib, and then I can come in here and just take a look, okay? The assistants super love that because I'm never in their way versus the doctors who are always trying to do this, okay? So again, I'm in charge of retracting the cheek over here, and then the assistant is in charge of the isolation and the suctioning over on that side. So for positioning here on the upper right maxilla, again, I'm going to come in and I'm going to have my burr kind of like this, okay? So I'll go over every single positioning on every surface of the tooth, okay? So if you take a look, this is kind of how I would do a crown prep here. This is how I would do a crown prep here. This is how I would do a crown prep here. This is how I do a crown prep here. Now, sometimes I need to be able to do a crown prep on the lingual of that tooth, and I'm just going to tell the patient to turn very far to your right. And you see now it gives me direct vision there. And then I will come in and prep the lingual of that tooth right there, okay? The other concept that I like to always train my assistants is I call it the switcheroo or the in and out, which is there are occasions where I'm working on potentially the buccal of 15 and I need to do my retraction because the assistant is getting in my way, okay? So what I will tell the assistant to do is, hey, we need to do the switcheroo or you need to do the in and out, meaning I'm gonna come in here and I'm gonna do my drilling for about 5 to 10 seconds. Obviously, water's gonna pool in the back of the patient's mouth, but then I'm gonna come out and let the patient do the suction. So you're gonna see the positioning be very similar to the anesthetic, okay? If I am prepping an anterior 6, that's gonna be my positioning right there, okay? As I come over here, I'm now starting to use this finger rest, okay? So when I'm going in the interproximal of 12 and 13 here, you're gonna see that I'm gonna start using this finger rest. When I come further back here to 14, do you see my thumb again is gonna be on that tooth, and I'm kind of using two hands here as far as finger rests. You can see my thumb right there as far as the finger rest, okay? Very important to use finger rests. And then 15 would be something like this. Again, if I need to, I'm going to come in and do the switcheroo or the in and out, and I'm mostly going to use the mirror as my retraction instrument versus my finger, which some patients don't like. So on the mandible, it's very similar, okay? We are going to use the mirror to retract, and then that would be my crown prep angulation there, okay? My crown prep angulation here, okay? Crown prep angulation here. As I start coming around the corner of the mouth or the canine, you're gonna see that I'm gonna start positioning myself to the back of the patient here, okay? Now, the only time that I'm ever gonna use my finger to retract a cheek is here in the lower anterior, because the mirror can be a little bit painful if you ride on the mucosa. So I will do in my cleanings and even here on operative, I will use my thumb to kind of keep that lip down, okay? So on the lower left mandible, you can see here how important it is for the assistant to retract, okay? Now, in the lower mandible, I am going to be having this exact positioning here, where I am going to be retracting, in charge of retracting the tongue, and she's gonna be in charge of retracting the cheek, okay? Now, if assistants have a hard time with retracting, let's say that there's some buccal mucosa there that keeps on falling into the area, she does have the ability to use another mirror, and we have that available to our assistants, where she could use a mirror on the buccal, and then I would be using a mirror on the lingual. But this is very important when you're prepping a crown. You do not want to be nicking the bottom of the tongue, okay? So if we take a look at what that would look like on the right-hand side, the assistant is in charge of the tongue, and I am in charge of the cheek, okay? So it could be that she's using the air water syringe tip, or if we're fighting a tongue, she will pull out the assistant mirror, and we'll have a doctor mirror and an assistant mirror to do that crown prep, okay? So again, lower right, she's in charge of the tongue. Mid, I'm gonna be in charge of the lip. And then the lower left, she's gonna be in charge of the cheek, and I am in charge of the tongue, okay? And that is really the positioning for operative procedures in the dental chair. So summary, getting on the maxilla, making sure that we are positioned in the right spot so that we can do essentially calibrate and then go in blind, okay? Using our mirror to do the retractions here. Having the assistant understand about the switcheroo or the in and out. And then the finger rests, okay? And ensuring that we're not getting in the way of our assistant. On the mandible, we're going to switch the positioning. Patient is going to come up so that we can have direct vision. And then I'm in charge of the cheek. Assistant is in charge of the tongue on the lower right. I'm going to be in charge of the lip here. And then I'm going to be in charge of the tongue here.